Hi, Dr. John Torres here with NBC News. On my Daily Doctor, where a couple times a week I sit down and I talk to you about headlines with COVID, with the pandemic, and what those headlines mean. And my goal is to get some information beyond those headlines, give you an understanding of what it means, and more importantly, give you an understanding of what it means for you, your family, your loved ones, and your community. Hopefully give you information you can use to get through this pandemic sooner rather than later and as healthy and as happy as possible. So let's start with that, and then I go to viewers' questions. So if you have questions, please send them while I'm talking about the headlines, and we'll get to as many of those as we can. But the first one I want to talk about are the big question I'm getting is why should people be getting the shot? And there's been a lot of information lately about a variety of reasons to get the shot, with people misinterpreting that to a certain extent. So let me go through a few of these. One of the biggest things I hear is that the shot is not 100% effective. So why get it, especially when it comes to the variants? And we'll talk about that in a minute. But if you look at the shots were Pfizer, Moderna, and Johnson & Johnson are the three we are looking at right now. Pfizer, Moderna, they've gotten authorized through the emergency use authorization. Johnson & Johnson is undergoing their emergency use authorization hearings this week. On Friday, they're going through the advisory committee meeting. FDA will decide on Saturday. More than likely, by all indications, it'll get its authorization as well. If you look at those shots, Pfizer and Moderna, 95%, around 95% efficacy. Johnson & Johnson, and they came out with information, it was 66% effective, 72%, that's worldwide, 72% here in the US, but they were looking at apples and oranges to a certain extent, and so you really can't compare the two groups of efficacy's effectiveness, and here's why. Pfizer and Moderna looked at overall people not developing COVID symptoms, be it mild to severe symptoms. And they said, okay, 95% protecting against that. But they didn't really break it down much beyond that. Although they did say that when they looked at it, in the studies, it was extremely effective, almost 100% effective against preventing severe complications, hospitalizations, and death from COVID, which at the end of the day is exactly what we want. Well, Johnson & Johnson is coming out with information, and we don't have all the data yet. We're going to get that later this week, and I'll talk about it on Friday. But the data right now that they've released is showing, again, that 72% effective here in the U.S., but as opposed to Pfizer and Moderna, which looked at overall getting disease, anything from mild, sniffles, low-grade fevers, body aches, fatigue, those things, all the way up to severe complications, Johnson & Johnson just looked at moderate to severe symptoms of COVID. And so they looked at a side group of that. And in that moderate to severe, it protected them 77%. It was 77% effective at preventing that. They also found out that in their study, and particularly in South Africa, where there's that B1351 variant, where it was predominant when they were doing their studies there, it's the only vaccine that looked at it during the predominant variant that we're worried about, is they found out that after 4 weeks, getting the Johnson & Johnson vaccine, remember it's a one-dose shot, that 100% nobody who got the shot ended up hospitalized or dying from COVID. So again, at the end of the day, that is the bottom line right now, is preventing deaths from COVID. And so all three of these shots do a great job of doing that. So when you see that number, when you hear people say, well, it's not 100% effective, so why get it? I'll take 95%. 95% is fantastic, which means you're getting an extraordinary amount of protection from getting COVID. And if you do get COVID, all three of these shots, including it looks like the variants as well, protect you from severe complications, hospitalizations, and dying from COVID, which at the end of the day, that's a win. That is the vaccine working very, very well. And so that's one of the things you hear about. The other things you hear about is that even if I get the vaccine, I still might spread the vaccine. And there are some public health officials that are criticizing others for saying we are underselling this vaccine a little bit. We need to let people know that, hey, if you get this vaccine, it's going to open up more things you can do. Other health experts are saying, wait a minute, we need to look at a population level, and we don't want people to go out there and just start taking masks off and congregating with other people. We still need these restrictions in place until we get to herd immunity. And so as far as it's spreading, here's why we still don't have a firm grasp on that, although data right now is showing that it looks like it's preventing the spread of the virus as well. But when the studies were done looking at preventing disease, preventing you from getting sick from COVID. The studies to look at preventing transmission take a lot longer. We wanted to get people vaccinated as soon as possible. And so they said, okay, now that we know it prevents disease, let's go ahead and start getting people vaccinated. And then we can look to see if it's stopping the spread of coronavirus, which is equally important to get the pandemic under control. And by all indications, it is doing a good job of that, particularly if you look at areas where clusters of people have high vaccination rates. Israel, for example, over 50% of the population has been vaccinated. Over 80% of 65s and above have been vaccinated. And they're seeing the transmission slowing down precipitously there. And they think that's because of the vaccine, and it looks like the vaccine is doing a good job of doing that. If you look here at nursing homes where high numbers of people have been vaccinated, if you look at different, like fire departments, for example, they'll have high numbers of people vaccinated and they'll have less people getting it, which is an indication that transmission is being shut down as well. Equally important. And so when you hear people say, why should I get it? It's not cutting down on transmission. That's not true. We just don't have the data yet, but the data is indicating that that will happen. And then again, the other thing you hear is people saying, well, these variants are coming about. Are we going to need a booster shot later on? Why bother now? The main reason is, again, because even though these variants, it looks like these vaccines, especially Pfizer and Moderna, which we have data on, are protective against at least the variant that comes out of the UK, the B117. It looks like they're doing a good job against that. As far as the variant coming out of South Africa, the B1351, or the one coming out of Brazil, the P1, still unsure how well it's effective against that. In labs, in the laboratory, it looks like it's fairly effective. It doesn't have the robust 95%, but it does have a high effectiveness, a high efficacy, which is great. And again, at the end of the day, preventing severe disease, preventing deaths is the key there. Johnson & Johnson's, they did their studies later on, so they did it while these variants were out there, and they found out that even though they're not that 95%, they're down in the lower percentage, 70% against that variant. In South Africa, it was 57% against the variant, but that's getting disease. Preventing complications or death, it was 100% after 4 weeks of being on a vaccine. So again, looking at these, there's two trains of thought for getting the vaccine. One is to get the vaccine so I don't get sick. In a perfect world, that'd be fantastic if the vaccine was 100% effective at preventing you from getting sick. But the other train of thought, which I think is even the more important train of thought, is if I get the vaccine and I do get COVID, or I get coronavirus, then I might develop COVID, but I'm not going to develop severe complications. I'm not going to be hospitalized. I'm not going to die from COVID. I'm going to recover from it. And if you've heard me on air on NBC, what I typically say is, if you get the vaccine and you get coronavirus and you get sniffles for a few days, you recover, have no long-term complications, that's a win. Even though you got COVID, it was essentially like cold-like symptoms, and the vaccine is doing its job. And so getting the vaccine is extremely important. Now, as far as herd immunity, it's anybody's guess as to when that's going to happen and what the number is. But most educated guesses right now are saying somewhere in the 80-85% range of population needing to get vaccinated, or natural immunity, although that natural immunity, we're not sure how long that lasts, to get it under control. And hopefully we get that by end of summertime, fall time frame. And it depends on the vaccination rates, not only how many are available, but how many people actually step forward and get it. Luckily, right now, numbers of people are stepping forward to get it. Hopefully that continues as the phases open up and more people are eligible for it. So that's the vaccine itself and why you should be getting the vaccine. The other one, and today over the weekend, we actually hit a milestone, an unfortunate milestone, a grim one, 500,000 deaths from coronavirus over the past year. That's 500,000 people have died from coronavirus. If you look at the numbers even further, the numbers of cases have been astronomical. Right now, I'm looking here, over 28 million cases here in the United States since the beginning of the pandemic. But there is a bit of a bright side to this, not to the deaths, not to the number of cases, but to what's happening right now with coronavirus. Right now, we have under 60,000 hospitalizations. That's the lowest number since September, which is fantastic. We have less than 60,000 cases a day. As a matter of fact, the last daily case rate was 56,000. And so that seems fantastic, and it is, because remember, back in December timeframe, early January, we were up 300,000 cases a day. Now we're down to under 60,000 cases a day. But you also have to remember, going back in time, end of May, June time period, last summer, we were around 20,000 cases a day, in some cases even a little under 20,000. At that time, we said that's a good start, but we still need to push this down further. 10,000 would be ideal. We never got that low. But now looking at the 60,000, even though that looks good compared to the 300,000, we still have some work to do. And that means doing the things we know we need to do. Wear a mask, social distance, wash your hands. If you go out to eat, be careful when you go out to eat, follow your state guidelines, and don't go out that often. Just, special occasions if you do. Those are the things that can really help out. Ventilate, small groups, all those things. We need to keep doing that, plus the vaccine. The main point here is that human behavior is driving these numbers down. More and more people are doing that, especially since they're not in the travel season, and that's certainly helping. We need to keep that going as time goes on. So that's the case numbers. And then the other one is right now there's information out there saying, if you looked at the study, looked at the headlines, it's saying that people who survive COVID might only need one shot. Instead of getting the Pfizer Moderna double shot dose, they might only need one shot. The reason they're saying, well, first let me tell you that right now this is all based on studies, and the FDA has it's authorized a 2-shot regime for Pfizer and Moderna, and that's based on the data during the human trials that showed at what level the effectiveness was the most, and it was at 2 shots, spaced 21 or 28 days apart. All the experts are saying, no, we cannot go with one shot at this point. This is right now theoretical. It's in studies. It looks like it might happen, but there's a few caveats behind it. And these are heavy caveats. One being, number one, it was authorized for 2 shots. We know if you get 2 shots, what response you're going to get. We know if you get 2 shots, you're going to get that 94, 95% effectiveness. If you had COVID and only get 1 shot, we don't know how high that effectiveness is going to go. And we don't know how long it's going to last, because COVID, we don't know how long that natural immunity lasts either. Right now, the guess is 3 months plus, but we're not exactly sure what that plus means beyond 3 months. Plus, you don't know how bad you got coronavirus. You don't know what your response was. You don't know what your immunity, how it built up to coronavirus. With the vaccine, we know the dosing you're getting, we know the immunity response to it, and we know what happens when you get the second shot. So even though you've probably heard headlines saying you only need 1 shot, you need to get both shots if it's Pfizer or Moderna, because that's the way those shots work. I just got my second shot 2 weeks ago. Today's the 2 weeks of that. So at this point, I have that full protectiveness from the vaccine that it can give me, the most it can give me. It's important to get that second dose. Very, very important. So again, let me go over these headlines here. Number one, why get the shot? We went through a variety of reasons to get it. It's important because, again, it's going to help prevent, even though it's not 100% effective, 95% is a pretty good deal. Plus, it's going to prevent complications, hospitalizations, and deaths, which is extremely important. We know that it looks like it's stopping the spread of coronavirus, which is important, the transmission. Details to follow, but it looks like it is based on what we're seeing around the world. 500,000 deaths. Right now we've reached that grim milestone. We're doing some things well. We're getting under hospitalizations down. We're getting cases down, but we still need to get them down even more. And then the 1 shot versus 2 shot. 2 shot is the way you need to go with this, because that's the way studies were done, and that's the way you're going to get that most protection possible. Now let me see if you have any questions.
Do I need to get a COVID test before getting the vaccine?
And that runs right into that last part I was talking about if you had COVID. Studies are showing that possibly, maybe, and a lot of caveats there, 1 shot might work, but at this point, no, you still need to get 2 shots, but you do not need to have a COVID test to go ahead and get the vaccine. If you're having COVID-like symptoms, then you want to get a test to check if you have COVID. If it's positive, you want to wait till you recover. But otherwise, no, you don't need a test. You don't need an antibody test. You don't need a PCR test or an antigen test in order to get the vaccine.
What happened to the flu?
So the flu just kind of disappeared this year, and here's why we think that happened. If you look around the world, Australia, so typically we look in Australia in the summertime, and that is going to tell us what's probably going to happen here in our wintertime. So Australia in our summertime, which is their wintertime, is their flu season. They had a very, very low flu season this year. We had an even lower one. They think that the reason that's happening, and it is interesting, we did a story on this at NBC, and we called some hospital systems that we went to a couple years ago in the midst of a huge flu season where they had flu tents set up, they had extra help coming in to try and take care of the surge of flu patients. And this year, they literally said, and this was, I think, about 2 or 3 weeks ago, so it was January, end of January, they said, we have not seen a single flu case this year, 0 flu cases. And to them, that was amazing. They hadn't seen that. I was talking to an ER doc, and I'm an ER doc, and I can't imagine a flu season where you don't see a flu patient in the ER. The reason we think that's happening is because people are staying home. People are wearing masks. People are social distancing. These are things that we talked about for years that should be done during the flu season, but weren't necessarily done, and certainly weren't done to this level. And so I think this is going to give us some lessons moving forward on things we can do to keep it under control. But you do have to remember a couple things. One, just because we haven't seen flu up to now, flu's tricky, and it can show up later. And so hopefully you got your flu vaccine. If not, you can still get it. But also remember, this year does not tell us anything about next year's flu season. So next year you're probably going to have to get the flu shot. Next year you should get the flu shot. Might have to get the coronavirus shot. It depends on how that works out with the variants and when we need a booster shot, at what point. But again, remember, this year doesn't tell us anything about next year. But the reason this year it's so low is that human behavior I talk about. That's helping with COVID, is helping with the flu as well.
How many people have died after getting the vaccine?
So right now, how many people have died after getting the vaccine? The last number I saw was about the 120 range. And by that, I mean people who died within a limited time frame of getting the vaccine, not necessarily dying from the vaccine. And the reason I'm saying it that way is because in the natural course of human life, people are going to die. And it's possible that a lot of these people died and would have died anyway, just happened to get the vaccine at the time they died. Some of these people died from heart attacks, and they had risks of heart attacks, and so more than likely they died at the natural place they would have died anyway. They had just gotten a vaccine a few days before that. Some of these were nursing home people that were towards the end of their life, got the vaccine, and then their life ended up the way it naturally would have, and they died. There are a few cases that possibly died as a result of the COVID vaccine. They're still looking into that. In particular, you've probably heard the case of a doctor who ended up getting this platelet dysfunction, is a better way to say it, and ended up possibly dying as a reaction to the COVID vaccine. But if you look here, and I'm looking at numbers right now, remember, we've had 20 plus million people get the vaccine. I think it's even more than that at this point. Again, I'm talking about 120 plus, 120-ish people that have died from it. So it's a very, very, very low number. If you look at COVID itself, we talked about 28 million people have gotten COVID. 500,000 people have died from it. Your chances of dying from COVID are much, much, much higher than your chances of any reactions, and even much higher, much, much, much higher than your chances of dying from COVID vaccine itself. It's a very, very safe vaccine.
Are there any long-term side effects of the vaccine?
So the question is, are there any long-term side effects of the vaccine? It does not look like it. And based on what we know about vaccines and what we're seeing right now, it doesn't seem to be that way. If you remember the vaccine human trials, there were cases of what's called Bell's palsy, which is a neurological condition that often happens when people get a viral infection or other things in their life going on that can cause Bell's palsy. Well, when they looked at the data, some of these people had Bell's palsy that were vaccinated. The majority of them in one of the human trials were people, there were 4 people, 1 was vaccinated, 3 were not vaccinated. So it was not a vaccine-related issue. There have been no case reports of Bell's palsy because of the vaccine itself. The truth of the matter being that as time goes on, we'll know more and more about this, but by all indications, it's a very safe vaccine, not just short-term, but long-term as well. But we won't know long-term until we get out to that long-term point. However, the vast majority of any side effects or complications from a vaccine happen within the first 60 days. And so once the human trials were done at that 2-month point, just to specifically look at that. And for the most part, we're seeing people that were vaccinated back in December, and they're doing fine. So,
if you get the shot, the first one, in one arm, do you have to get the second shot in a different arm?
That's a great question. If you get the shot in one arm, you need to switch arms for the second shot. The shot is an intramuscular shot. And the reason it gets down to the muscle is because it works by getting the vaccine around the muscle cells, and then it works inside the muscle cells to do what it needs to do to alert the immune system. You can get it in one arm both times. I got it in my left arm both times. You can switch arms, whatever works for you. And people are kind of 50-50 split on, do you get it in your dominant arm so you move it around more during the day, so just by natural movements you exercise that arm, which is important because that's going to cut down on the arm pain, or do you get it in your other arm so you can keep throwing it around, moving it around a lot while you're still doing the things you need to do with your dominant arm? I go by the side of getting in my non-dominant arm. I just think for me that works better. Other people get it in their dominant arm because it helps them throughout the day do the things they need to do and move it around, so that way it ends up helping out with the pain and the swelling we talk about. That is one of the side effects of getting any vaccine, including this one. So it's up to you. It's a personal choice. But you can switch arms. You can keep the same arm. It doesn't matter.
Is it okay to take allergy medication prior to the vaccine to prevent allergic reaction?
So the question is it okay to take allergy medications prior to getting the vaccine to prevent allergic reactions? You really don't want to do that, and here's the reason why. People talk about taking Tylenol, which is acetaminophen or ibuprofen, or allergy medications prior to getting the vaccine because they're worried about the possible pain from the vaccine or maybe the fevers they get. You don't want to take the acetaminophen, which is Tylenol, or the ibuprofen before, and the CDC has come out saying the same thing, because there is the theoretical possibility that you could dampen down your immune response a little bit, because these are anti-inflammatories to the vaccine, and they want the most robust immune response possible. However, the next day, your immune system's already kicked in, and if you're starting to feel those low-grade fevers, those body aches, those types of things that are your immune system kicking in to develop what the antibodies it needs to fight off the virus, then you could certainly take acetaminophen at that point. I'd shy away from ibuprofen only because, again, it has an anti-inflammatory response that's stronger than acetaminophen, and we want to make sure that you do have the most immune response, and the part of that's the inflammatory response possible. And even better if you don't have to take either of those, and you can go ahead and just use warm pads, drink plenty of fluids, rest throughout the day, those types of things. As far as allergy medications, you shouldn't need that. If you have allergies to foods, if you have allergies to pets, if you have allergies to dander, to hay fever type situations, any of that, then you shouldn't really need to take that beforehand. And the concern is if you take that beforehand, will it mask any early signs of allergic reactions you might be having? Again, remember, the allergic reactions to the vaccine are extremely low. The anaphylaxis, the life-threatening reaction, is 0.001%. It's astronomically low. I think the highest number is in one of the vaccines, 11 out of a million people. So that's a very, very low number of people. But they want to make sure at the same time that 15 minutes of observation, they're truly observing you. So if you take allergy medicine beforehand, it is possible it could be masking something, so you don't want to do that either. So your best bet is just to walk in there like you normally would, get the vaccine, and then the next day do those things we talked about to treat any reactions you might be having. Those reactions are extremely, extremely short-lived. But again, thank you very much. These are all fantastic questions. And I particularly like the one about switching arms, because that was one that a lot of people have. And I think even when I went up for my shot, I was like, do I want the same arm or a different one? And again, it totally depends on you and how you typically get vaccines and what you do with your arms after you get the vaccines. But we talked about why you should be getting a shot. It's important. And so a lot of the things you've heard, it's not 100% effective. It's very high, 95%, but it's 100% effective, or nearly 100% effective at preventing deaths, which is important, from deaths from COVID. 500,000 deaths, a grim milestone, but case numbers are coming down, hospitalizations are coming down, but we need to do more to bring those down even further. And then you might have read the headlines about people who have survived COVID might only need one shot. Not at this point. That was a preliminary study. Studies are still out there, and my guess is we're still going to go forward with the 2-shot dose for Pfizer and Moderna. Johnson & Johnson is 1 shot, but even they're looking at 2 shots, adding a second shot as a booster to try and get those numbers high, because the higher numbers we can get, the more protected you are, the better off we're going to be, and the quicker we'll get through this pandemic. So again, thank you very much. It's Monday. I hope you have a fantastic week. And like I always say, I hope you, your family, your loved ones, your community, you're all doing what you need to do to survive this as best you can and to get through it in as happy and healthiest fashion as possible. Thank you.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.